Hello, everyone. Welcome to Changing the Narrative, promoting smoke-free recovery in behavioral health settings. We have a lot of great speakers for you today to talk about this very important topic in behavioral health and recovery treatment and how tobacco cessation plays a big role in this. So I wanted to start off with a poll question, a couple questions that I hope you can all answer. Let me just release those now. So we have two questions. Our first is your workplace 100% tobacco and smoke-free? Please feel free to answer yes, no, or if you're unsure. And then our second question is, how do you feel about 100% tobacco and smoke-free workplaces? Okay, let me share those results with you. Okay, so it looks like most people are at 100% tobacco and smoke-free workplaces. And then it looks like most people have a positive feeling about tobacco and smoke-free workplaces. So we love to hear that. Let me stop that. And before we go on, I just want to thank everybody again for joining this webinar. I'm Brittany Richardson from NJPN and Tobacco Free for a Healthy New Jersey. And now I'd like to introduce Michelle to go over some information before we begin with our speakers.
Hello, everyone. So before we begin, I'd like to take a moment to acknowledge the vital work you all do. Supporting individuals in their journey to overcome addiction is incredibly challenging and deeply important work. We understand that the primary focus of treatment centers and their clients is tackling their addiction and alcoholism. Our goal here today is to explore how we can improve those overall success rates. We're here to collaborate. It's important to examine the role of smoking policies within treatment settings. Unfortunately, those with substance use disorders and mental health disorders have been disproportionately targeted by tobacco companies. It's important to take a look at the role smoking plays in overall recovery and long-term wellness. Research increasingly shows that addressing tobacco use through cessation resources and more structured smoking policies can significantly enhance a client's overall recovery success. So now I'd like to share with you all a video from a behavioral health center that we currently work with. Again, I'm Michelle. I'm a counselor at our Atlantic Quit Center. I'm also the Southern Regional Youth Coordinator for Incorruptible Us. So I'd like to introduce Crossroads Behavioral Health. We've been helping with current smoking policies and providing smoking cessation groups for many years with this company. So this video is from their perspective on how supporting clients with their quit can have overall benefits to the clients and the facility.
Hello, everybody. My name is William Robinson, and I'm the supervisor here at Behavior Crossroads. We are a comprehensive care facility. We target SUD, which is substance use disorder / mental health disorder. We treat the whole client holistically.
Hi, my name is Debbie Ozer, and I'm a administrative assistant here at Behavioral Crossroads. I've been working along with the Quit group for the past approximately 3 years. During that time, we have seen a lot of our members participate in the group. They participate in the group to receive a lot of benefits. They receive education as far as how harmful smoking really is for them. They also receive the nicotine replacement therapy, which is very helpful to them. They also receive the education as far as what the nicotine has done to them throughout the years and why it is hard for them to quit.
Hi, I'm Keith Johnson. I'm a case manager here at Partial Care, and I'm talking in reference to the QUIT program, how important it is for dealing with mental health patients, and that the QUIT program is very positive. Once the clients get involved with it, then they actually like it between the patch and the medication and give it a try. And dealing with mental health, a lot of times it takes a lot to get through to some of the clients in regards to smoking and their safety and their health. So we stress that very much, that it's important to get in the program, especially if they want to stop smoking.
They benefit from the group because they hear others' experiences as far as the struggles that they have, the successes that they have, the ways that they have helped themselves reduce or stop smoking, and all of that is beneficial. They kind of utilize it like anyone would utilize an AA group or an NA group.
And for a lot of them, it's hard when they're fighting the triggers and the cravings and the urges to stop smoking. Or we try to encourage them to cut back from 10 cigarettes a day to 5 cigarettes a day, or whichever ones they can deal with, till the patch or the medication starts working through the program. But it's an excellent program. The clients like it, and we constantly encourage new clients to join the group when available. And for some, it's a tough battle because they're fighting their cravings and urges and stuff. But we try to encourage them, the importance and the dangers of smoking, especially at an older age as adults.
A lot of individuals who have mental health or substance abuse do smoke. So the fact that this is available for them in the community where they're receiving those mental health and substance abuse services is very important. And the fact that they can participate even once they leave this program is extra important, because there are some who are successful to graduate, there are some who move to other areas, but this is something that is available to many individuals.
And one of the things that a lot of society has forgotten about, because a lot of addiction is always centered around alcoholism, heroin addiction, fentanyl addiction, and meth, and all of these things. But somehow the nicotine, which is part of addiction, it has destroyed a lot of lives, because it's the #1 cancer-causing substance that there is. And it's one of the hardest addictions to completely stop. So what we're trying to do is bring that front and center and let people know how important it is to start the process of not smoking, as well as secondhand smoke. A lot of people forget about the secondhand smoke. Family members smoking in the household, around the children, around whoever, is one of the leading causes of cancer again. So, with the smoking cessation groups, I believe it's very important that they are a part of any treatment facility, because nicotine is so addictive. It's very addictive, and it's not easy to stop doing. You have people, what we call the disease of addiction, meaning that, you can substitute one thing for another. Some people stop drinking and start smoking marijuana. They may stop smoking marijuana, start vaping. Vaping is beginning to, there's a lot of new studies, and it's more being revealed so far as with the vaping.
Smoking cessation is really important, especially in a mental health environment, because it gives them the opportunity to learn how to change their behaviors. It also provides the education to not only the members who attend here, but also the staff and the other employees that support the program, allowing them the opportunity to have the education to support their clients, and also the education to support themselves in their goal of reducing smoking and or stopping.
They love the groups. They really look forward to seeing Michelle and Allie and everyone. I've heard a lot of good things about it. They've even have encouraged me to stop smoking, and it's been about 3 months now since I had a Newport 100. I smoked for 45 years, and these guys coming in, it really encouraged me, and they gave me some suggestions on what to do. And and I feel great. I'm 61 years old, and again, I smoked for 45 years. Newport 100s, and I was able to smoke with the patches, and eventually I went from 14 to 7 milligrams and to nothing, and I feel great. And that was on, I believe, not quite 3 months, but I think it was March 2nd, okay? And I'm telling you, if it wasn't for these guys coming in and seeing them smiling and encouraging me, I probably would be still smoking, along with a lot of other clients here. Again, they love the scoop. A lot of them, some of them are smoke-free at this time. Some of them are working their way towards complete abstinence. And again, this is a great program that has been put together for the clients, and we look forward to seeing them in the future as the years go on. As long as they decide to be here with us, they are welcome. Thank you.
Hopefully that was a powerful video on the impact that quick groups have at treatment facilities. William's words about how it even encouraged him to quit is really great. So we have Dr. Michael Steinberg up next as one of our speakers from Rutgers. Let me just get a moment to gather his presentation up. I just want to remind everybody as well to utilize the Q&A function during our speakers' presentations. So that way we can gather those for our Q&A panel at the end.
While we're pulling this up, just wanted to say good morning to everybody and thank you for the opportunity to speak this morning. I think that this is going to be a lot of preaching to the choir, because I think a lot of the folks on this webinar have kind of bought into the importance of tobacco treatment in these settings. But just to kind of reinforce that, you'll probably hear some of the same themes in these presentations, and I think it's important to restate them because outside of this group that is kind of already or hopefully already bought into the concepts, there's a lot of people out there who still need to understand the importance of dealing with tobacco treatment in behavioral health and substance use treatment settings. So as Brittany mentioned, my name is Mike Steinberg. I'm a physician by training. I work at the Rutgers Institute for Nicotine and Tobacco Studies as the medical director, and I've been doing tobacco treatment work now for about 25 years. So next slide. Okay, and again, you'll probably hear this several times, but there's a disproportionate amount of tobacco use among folks with mental health diagnoses and substance use disorder. So you're always going to see a disproportionate impact in terms of the health effects as well as consumption of cigarettes. So this is one of the reasons why it's so important that we address this issue in this group of people. Next, please. People with mental illness smoke at higher rates than the general population. They have higher levels of dependence. When they do make quit attempts, they have more difficulty in successful abstinence. However, a real important concept, two important concepts that you're going to hear hopefully over and over again, and you need to remember, are that people with mental illness, even serious mental illness, want to quit smoking, and if provided with adequate evidence-based treatment, can be successful in quitting smoking. So there's a lot of misperception that, number one, people in behavioral health or other substance use treatment programs don't want to quit smoking. That's not true. And number two, that they can't quit smoking if they make a quit attempt. That is also not true. Next, please. Again, in terms of the prevalence, looking at mental health diagnoses, you can see that the smoking rates are much higher in both men and women with diagnoses such as severe depression compared to people that without these diagnoses. So if you look at the graph, the rates in blue are often double or even more than double the rates in populations without depression. Next, please. Smoking prevalence overall in people with serious mental illness, such as schizophrenia, is estimated to be as high as 80%. So think about that. 4 out of 5 people with schizophrenia may be tobacco users. So it's almost uncommon to come across people with certain serious mental illness like schizophrenia who don't use tobacco. However, again, the majority of these people who do smoke want to quit, and but they often don't get the help they need. The reason this is so important is that people with serious mental illness like schizophrenia die much sooner than the general population. You see this statistic 28 years earlier. It's almost unbelievable the impact that tobacco has on people with serious mental illness. People with serious mental illness also spend an over proportion of their income on tobacco, a third of their monthly income on tobacco products. So it impacts their quality of life as well as their life itself. Next, please. In terms of treatment considerations, and I want to thank for many of these slides my colleague, Dr. Kim Casarona, who's kind of our local expert on tobacco and mental health diagnoses. And when she's working, she runs groups specifically for people with serious mental illness. And you do need to modify your general evidence-based treatment somewhat. So treatment may require modification to our traditional behavioral interventions. We want to increase the level of support that we can offer people with serious mental illness. Some just examples of the way we might modify our treatment, the way we remind people of appointments, encouraging them to write things down and kind of keep track of alternate behaviors and their coping strategies. Have maybe additional check-ins with people that you might not have with people without serious mental illness. You may need to allot more time for your appointments in terms of treatment. And just in general, just being aware of the need for social support in treatment. So if you're able to offer group treatment in populations with serious mental illness who use tobacco, it can be exceptionally helpful. Next, please. I just want to touch on some of the evidence. So this is a Cochrane review. If you're not familiar, Cochrane review is kind of like a summary of studies that are kind of pulled together and pooled in terms of their data. This is from 2021, and it included 102 studies, which represented almost 170,000 participants. And some of the conclusions they came to is that the common misperception that smoking helps people manage stress and maybe that there is a common perception that people use tobacco to manage their stress and kind of self-medicate themselves. However, there are many biologically plausible issues that demonstrate that smoking may actually worsen mental health. And when they looked at these 100 or so studies, they found that there's evidence that mental health does not worsen when quitting smoking. So if smoking was a form of self-medication, then stopping smoking should make that worse. And in fact, when people do stop smoking, it's associated with a small to moderate improvement in mental health. And these findings were both in people with and without diagnoses of mental health conditions. So people's mental health improves when they quit smoking, and there's no evidence that it worsens when they undergo treatment. Next, please. In terms of substance use disorder, again, the smoking prevalence is much higher than the general population, as high as in the 60s, 70s, or 80% prevalence rates. Tobacco use causes more deaths in people who are receiving treatment for substance use disorder than alcohol or the drugs that they're being treated for. Over half of the deaths in people with substance use disorder are from tobacco-caused disease. Up to 80% of people in treatment are interested in quitting smoking. And I'm going to show you evidence that shows that smoking cessation incorporated into substance use treatment enhances not only their success for quitting smoking, but also their success for quitting their other substances. Next, please. This is a study, again, a meta-analysis looking at 19 trials, which looked at the outcomes associated with quitting smoking among individuals receiving substance use treatment. They found that there was a positive effect for smoking abstinence in the short term. It didn't persist up to 6 months, and that smoking cessation interventions that were provided during substance use treatment led to an increased likelihood of long-term abstinence from alcohol and the other substance themselves. Next, please. So just to show you this graphically, what this kind of table shows is each of those lines is an individual study. And what you see is to the right of that central bar that's under the number 1, if the dot is to the right of that bar, it shows that the intervention improved smoking abstinence. If the dot was to the left of that central bar, that was a study that showed that smoking abstinence was worse in the outcomes. And this is among people who receive tobacco treatment as part of a substance use treatment program. You can see almost all of the studies showed that the smoking abstinence rate was improved in tobacco treatment that was incorporated into substance use treatment. Only one of them looks like it's below the line, and a couple are close to the line, which the line would mean that there's no benefit. So most of them showed a smoking benefit, a quitting smoking benefit for tobacco treatment incorporated into substance use treatment. Next. The other question is, does Does incorporating tobacco treatment or does quitting smoking worsen your abstinence rates for other substance use? This is, again, a meta-analysis looking at this question. The dots that were to the right of that central line indicate that the abstinence for the alcohol and other substances is better if you incorporate tobacco treatment into your substance use treatment program. Again, the misperception that if people try to quit smoking while undergoing treatment for other substance use, they're going to do worse, just is not borne out in the evidence. Next, please. So for this part, the summary, I just want to reinforce that people with serious mental illness, co-occurring substance use disorder who use tobacco face serious health consequences from their tobacco use. They want to stop smoking, and given proper treatment, they're able to successfully stop. In addition, they can do so, they can quit smoking without negatively impacting both their mental health or their abstinence from other substances. Next, please. So what can we do? One of the things that we do at the Institute for Nicotine and Tobacco Studies is we run a tobacco treatment specialist training, and we partnered with New Jersey Division of Mental Health and Addiction Services this past year to offer training to staff in their program. So we had about 50 or so people participate in our tobacco treatment training, and we just wanted to follow them up to kind of see how they incorporated the training and what barriers they encounter in delivering tobacco treatment. So this is just a description of the people who participated in this training. You can see the race, ethnicity. The majority were female, and they had varying levels of education. Next, please. These people came from many agencies throughout New Jersey to our training. Next. And we followed them up 3 months after the training to see how they might have incorporated what they learned. Next, please. So the barriers they reported in incorporating tobacco treatment into behavioral health and substance use settings included patients not wanting to start tobacco treatment while they receive treatment. Again, is that the individual person's decision, or do they have this misperception also that it's going to harm their outcomes? Another barrier, people don't have access to an environment that supports tobacco cessation. They are in a short-term residential facility and are discharged before receiving full treatment. Sometimes there's a lack of training or experience in providing tobacco treatment, and that was our hope, something we could address in delivering this kind of treatment. And then finally, the healthcare team doesn't prioritize tobacco treatment when treating co-occurring mental health or substance use. And again, hopefully this perception and this activity is changing, and we are starting to incorporate and prioritize tobacco treatment into these treatment settings. Next, please. Again, how might they use this training? You can see that 46% said they now provide tobacco treatment and had not provided it before in their treatment setting. So almost half of the people who came through this training were now incorporating it into their treatment setting, which is great. Next, please. And then almost all of the people said that their knowledge and skills increased as a result of the training. Next. And almost 70% said they planned on obtaining certification as a tobacco treatment providers and would encourage others to participate in this training. Next. So just as a reminder, messages that you will hear: tobacco use is highly prevalent among behavioral health and substance use populations. Therefore, it's critical that providers who work in these settings address tobacco treatment as part of their role. Concurrent treatment for tobacco use in behavioral health or substance use treatment leads to better outcomes, not only for their smoking, but also for their other substance use and mental health diagnoses. And that if we train people, train staff for tobacco treatment, they can use those knowledge and skills to incorporate these treatment activities into their behavioral health setting. That's it. Next. I think we're done. Thank you very much.
Thank you, Dr. Steinberg, for that data, that important insight. Let me bring up a poll really quickly for everyone. This poll will just have one question. So as Dr. Steinberg mentioned in his presentation, oftentimes we find that clients are using tobacco and nicotine products as well. So if you are seeing clients, please respond in the increments of 20. I'll end the poll shortly. See, some are still coming in. Okay. Share those out. So it seems that most are experiencing somewhere between 60 and 80% of their clients using, which I think lines up exactly with the data that you shared, Dr. Steinberg. So thank you. Okay. Now I'd like to welcome Melanie Bennett from Preferred Behavioral Health. Let me get your presentation up. Here we are. Welcome, Melanie.
Hi, thank you. Can you hear me okay?
Yes.
Okay. Good morning, everyone. Thank you, Dr. Steinberg, for that presentation. No matter how many times I hear information about tobacco use, my mind is blown and I always learn something. So thank you. I also wanted to say thank you to NJPN for inviting me to be a part of this very important conversation, and I'm honored to be here. So yes, my name is Melanie Bennett. I'm a licensed clinical social worker with Preferred Behavioral Health Group. I currently am the director of our Adult Intensive Outpatient Treatment and Support Services, better known as IOTSS, and I do the clinical oversight for our adult mental health program. So today's topic, anti-tobacco use, right? It's a hot topic, no doubt. But for me, it's actually very personal. So before we dive in, I'd like to tell you a quick story about someone very special to me. My dad, we'll call him Matt, that was his nickname. And you could go to slide 2, actually. So my dad was a proud Marine. He served in Vietnam. He was a Vietnam veteran, Semper Fi. If there are any veterans or active duty service members, military families on today's webinar, I truly appreciate your service, sacrifice. Thank you. My dad always reminded me not everyone who served had a choice and experienced things that changed them forever. So I try not to say thank you sometimes. Just there's so many complexities behind it. So anyway, I appreciate your service. So my dad battled PTSD and anxiety, long-term health issues from Agent Orange exposure. He also had 2 big unhealthy coping mechanisms / vices: coffee and cigarettes. I'll let you guess which one of those ultimately contributed to his untimely death at the age of 61. That personal experience is exactly what inspired me to lead the smoke-free initiative for my agency. So in 2002, when the organization announced a plan to go smoke-free, they opened the application process and they were looking for a team lead. So I just knew I had to apply. I felt like it was something I could do in honor of my father and to help others. So today I'm here to share our journey at Preferred Behavioral and what it looked like to roll out a smoke-free policy in a behavioral health setting, what we learned along the way, which was a lot, and how we approached it through a trauma-informed lens, which is probably the most important part. Oh, and by the way, my dad would be very happy that this picture was up for everybody to see here. Okay, so let's jump in. Slide 2, thank you. So PBHG, this was the foundation. This is on our website, but this is just a foundation of kind of what I kept in mind when I was leading this initiative. So we're a nonprofit, just so people, if you don't know, Preferred Behavioral Health Group is a nonprofit community-based organization providing individualized services, focusing on mental health, addiction recovery, and overall wellness. We do adults and children. So our promise on the bottom right there, our promise is to remain rooted in our mission through a trauma-informed culture, right? Again, that's going to be a very important piece to this. You can go to slide 4. Okay. So what sparked this conversation, right? Why now? I think one of the polls, or Dr. Steinberg said that how many people were smoke-free, and I think pretty much everybody said yes. I guess we were kind of late to the party because we started doing this in 2022. So why now? Why did we decide to do this now? Next slide, please. Really, I mean, it was just time. And also, this is a good time to mention that I'm not an expert on this topic like Dr. Steinberg. I was involved in our smoke-free initiative from 2022 to 2023. It was a year-long project. So just think that's important to say there. So as Dr. Steinberg mentioned, national statistics emphasize the need. 20% of adults smoke 40% of all cigarettes. 40% of cigarettes are smoked by individuals with a mental illness or substance use disorder. And as Dr. Steinberg also mentioned, it also goes hand in hand with other usage. So it wasn't uncommon, like my father, the cigarettes with the coffee, right? It goes kind of hand in hand. And the overlap between smoking and behavioral health, we just couldn't ignore it anymore, essentially. Next slide. So challenges before the policy, right? Our pre-policy challenges. Personally, I was, where do I start? Where do I start? And then where do I start? So after being selected as a team lead for this initiative, we had our first agency-wide meeting in that May. I think it was May 2022. The administration had already informing everybody about this change. A lot of talk started to happen, and essentially the prep had started. So as an agency, of course, we had some initial challenges: resistance, some negativity, clients with SPMI, severe persistent mental illness, gathering outside to smoke, right? Leaving program during the day, missing groups. We had difficulty managing the non-PBH owned properties. So we own a few of our buildings, but not all. So you can imagine trying to instill policies in buildings you don't own can be very difficult. It still remains to be difficult. Managing interventions in the moment, of course, added pressure for staff. So for supervisors to have conversations with staff who smoke, but also the staff who have to interject and intervene with the clients who smoke and what that looked like. And just like we all know, any change is very difficult, for anybody. So especially something like this, but we stayed committed. We still are. Next slide. So leading our change, right, with compassion, our trauma-informed approach. We applied a trauma-informed lens. Like I said, was a very important part of this in implementing the smoke-free policy. We really wanted to make sure that we aligned it with our agency's core values. So through that trauma-informed lens, that means we focus on the understanding and empathy aspect. We really try to recognize that for many of our clients and staff, smoking is deeply tied to stress, right? How many people go out for a smoke break? And it's just really an unhealthy coping mechanism, and people's personal histories, unfortunately, are linked to trauma. So there is a correlation with that. So rather than imposing this rule, we just try to prioritize the education and the understanding of why we were doing this. One of our top priorities was to make sure that the policy didn't feel punitive. I don't think people respond well to that for staff or clients. We weren't trying to punish people for smoking. And this part is really important. Instead, we were offering the support for the change. I think that's really key, the support for making the change. We knew that sudden or harsh policies can cause individuals, especially with trauma, to shut down, feel unsafe. So we really took steps to communicate the policy in a way that was respectful, gradual, compassionate. Everything we did was rooted in creating an environment of safety, trust, healing. That's what trauma-informed care is all about, right? Ensuring that people feel emotionally and physically safe, I think, is important, and that they're respected and listened to, and that we were offering paths to recover, not necessarily these barriers. And we had to support the staff too. It wasn't just the clients, offering education, resources, and really a space for discussion. change isn't easy, right? So we made sure we stayed aligned with the trauma-informed values throughout the entire process. Well, we did our best too, still do. Next slide, please. Okay, so who helped? So I was a team lead. Tara Chalakani is our CEO. She had a big part in this. She was a big help for this, a mentor for me. Julie Venor, our chief operating officer, who also oversees all the facilities. We, of course, had to involve HR, our vice presidents, staff, clients. And then in May, was it May 2022? That's when we formed it was Smoke Free in 23. That's what we called it. And we developed our dream team. So, and after that, we try to establish and gain as many resources as possible, which we could not have done without those individuals. So let's see, we had virtual meetings every month. Originally, we did it hybrid, but we found people kind of responded more to the in-person, and then sharing resources to support the client's recovery. Next slide. So we introduced the policy slowly and thoughtfully. We started a gradual rollout in 2022. Like I said, we had these monthly meetings. It was kind of an open space for people to talk about their concerns, ask for resources, help, develop policy, help instill the change. And we implemented the policy at a few locations at a time throughout the span of a year. Again, we didn't want to do this overnight, nor could it be done overnight. And our trauma-informed mission really helped guide every step of this process. Next slide. So ongoing efforts, right, to support this smoke-free environment, education, and that's probably the most important aspect. Dr. Steinberg was mentioning the treatment specialist, tobacco treatment specialist. We had some staff do that training. I don't know if you saw preferred behavioral health. I looked for it. It was on the list that he showed. And it's great for peer specialists to conduct these groups because it's really about how can we relate, like talking as if from actual personal experience, right? That always helps. The policy reinforcement is, respectful, consistent communication. Again, those resources, I try to get my hands on as many NRTs, nicotine replacement therapies as I could, that samples, websites, apps, support groups. I probably contacted everybody in New Jersey that I could possibly think of, including NJPN. Next slide. So based on my experience as the team lead, I like the lessons from the front lines, educating myself about tobacco use and cessation. I was floored that there was a thing called third hand smoking, by the way. That was just bonkers to me. And outreach matters. So one of the first people I contacted, I'm sure Dr. Steinberg knows, is Dr. Jill Williams, professor of psychiatry and director of the Division of Addiction Psychiatry at RWJ Medical School. Very helpful. They helped bring in Choices, the peer program, to come in and talk to some of our clients and staff. I also work closely with Central Jersey Family Health Consortium, also came in and, talked to the clients and staff regularly. So I stayed persistent. I tried to be as compassionate and flexible as possible. I was sending emails regularly to the agency. I try not to bombard people. I'm sure we all get enough emails as it is, right? Who needs more? So I don't know if anybody's heard of the rule of 7. I have a marketing degree, so I just can't help but talk about that stuff. So rule of 7 in advertising is a person needs to see an advertisement approximately 7 times to remember it. So I kind of kept that in mind with my emails and the information that I was disseminating to the agency, and just trying to support them as best as possible, lead by example. And I try to have fun with it, having a sense of humor and have fun with it, keep it interesting. The American Cancer Society, the GASO, Great American Smoke Out, which is I think the 3rd Thursday of every November. So because it's around Thanksgiving, I held a contest because the Great American Smoke Out is about pledging to not smoke. So I had this tagline and I had a contest. So you don't have to quit smoking or quit cold turkey, but you could pledge to win one. And somebody actually won a cold turkey for Thanksgiving. In our first meeting, there's a clip here. We don't have to watch it necessarily, but if anybody watched Friends, the episode where Chandler is trying to teach Joey how to smoke for his part, and it's funny, obviously. So when I first had my meeting back in May of 2022, that's something that I kind of led with, because I think that there needs to be some kind of fun and interest in this topic. And that's about it. I think we'll do some Q&A after, but. And thank
Yes.
you.
Thank you so much, Melanie, for sharing all of that information. Hopefully those who are involved on the staffs of these facilities can learn from your work and all that you guys did. So thank you again.
Thank you.
Yeah. Let me just pull up some more information. Bear with me just a moment. I'll introduce Elise.
Good morning, everyone. I'm Elise Knapp, and I'm the Northern Regional Tobacco Programs Coordinator for Tobacco Free for a Healthy New Jersey. And I'm going to jump in and I'm going to talk about our Working Well initiative. I just wanted to thank our presenters, because our, changing the narrative, right, was part of the title for our webinar today. And I think we heard so many great takeaways. The higher use of this population of behavioral health and substance use populations, and the need for tobacco cessation, and those serious health outcomes, but that there's better overall mental health outcomes, especially when it's incorporated into treatment, and that there weren't negative of mental health outcomes, and the trauma-informed care. I loved hearing about, it takes a team and the ongoing efforts, that it isn't like a one and done. It can be a heavy lift in this setting, but love to hear that lived experience of going tobacco free. So I'm going to talk about our Working Well Tobacco Free initiative, the general Working Well Tobacco Free, because workplaces, there's a lot of different entities that can be workplaces. So we'll work with all workplaces, and the big goal is healthy employees, happy, more productive employees. So we have a lot of ways we can support that work: policy toolkit, technical support, cessation groups, coming in for presentations. We do have some specialized beyond working with behavioral health treatment centers. We have a focus on childcare and daycare centers, and that's really where second and third hand smoke is a really important part of that narrative. And then we have a Breathe Easy al fresco initiative for outdoor, like outdoor dining. It could be outdoor venues, places where people can still be exposed to secondhand smoke, where we can work with our workplaces in those settings. And the next slide, please. Just an overview of a few of our other initiatives. I know we're going to take Q&A later, but we did have a question about our youth initiative, about youth prevention, and we do have a youth initiative entitled Incorruptible Laws. We work with our college campuses under NJ Quits. Yes, Michelle, I saw you put that in the chat, so thank you for that. We have a smoke-free housing initiative, our outdoor smoke-free places. We have our free Breathe Easy signs, Working Well. We work at the point of sale, and we do have a focus on policy change. And I think next slide, please. We're just gonna have a quick slide about, just the importance of writing the policy and, creating a smoke-free environment. Again, when Melanie spoke about the ongoing efforts and how much is needed to make that happen, the policy is, the key piece that gets things started. And these are just some key things: promoting quitting, restricting tobacco use, and improving health benefits, and easier access to cessation resources. And that is it for me. And I'm going to pass over to Maya to talk about some cessation resources.
Hi, everyone. Good morning. My name is Maya Shinoy. I am the Tobacco Programs Manager at the Cooperative. So in New Jersey, we have a ton of cessation resources, which can help with both smoking, vaping, and other tobacco products. These programs are also not exclusive to each other, so you can encourage your clients to enroll into multiple programs if you feel that they need that additional support. At the cooperative, we oversee 3 of these programs. We have the New Jersey Quit Line, which is a free statewide program. It's 24/7, it's multilingual, telephone and web-based counseling service for anyone 13 or older who is ready to quit smoking or vaping. Participants do get 5 sessions with a quit coach, and the quit coaches are trained in working with BIPOC and LGBTQ+ populations. To enroll, you can have your clients self-enroll by calling the number on the screen there or visiting our New Jersey Quit Line website. We also have Mom's Quit Connection for families, and this is a free one-on-one counseling service specifically for pregnant individuals, parents, and caregivers of children 8 or younger. So if any of your clients have young children at home and your clients are smokers, this is a great program to help them quit and kind of reduce the level of secondhand and thirdhand smoke that the child at home is being exposed to. This also includes anyone who is actively trying to conceive or working with children as well. So daycare workers, teachers, anyone like that as well. To enroll, you can call the number here or visit momsquit.com to refer your client. And then finally, we have Quit for Kids, and this is a texting support program for the same population as Mom's Quit Connection. So again, pregnant individuals, parents, and caregivers with a young child. Clients are automatically referred from the perinatal risk assessment, but they can also self-enroll, and this service sends weekly texts encouraging people to quit, and also sends them reminders for taking care of themselves, which is really important in the behavioral health setting, especially. So there will be tips like staying hydrated and, relax. Go to the next slide. So in our poll earlier, the majority of you did say that more than half of your clients use tobacco or nicotine products. And part of helping clients is really making sure that they're informed and educated about tobacco. And so for that, we have a number of trainings and presentations that we can offer professionals and clients. So we have Ask, Advise, Refer, which is a brief CDC evidence-based intervention for professionals. It's about an hour long and it offers nursing and CHES credits. And we can actually train your staff on how to conduct the brief tobacco intervention and also gain an understanding about the impact of tobacco. We also have some presentations for consumers and clients and community members. So Tobacco 101 is a general overview of tobacco products. Can We Talk is about how to have conversations with young people about vaping. And Get Ready to Quit talks about the behavioral side of quitting and kind of going through the stages of change. In collaboration with our Prematurity Prevention Initiative, we also have a smoking and pregnancy presentation, which discusses the impact of smoking on the fetus. So if you're interested in any of these presentations for your staff or for your clients, you can contact me and I'll put my information in the chat, as well as some of our quit resources. I'll also drop a link in the chat for our provider toolkit, which has a lot more information about everything that I just talked about, plus a section on mental health and tobacco use. And with that, I'll hand it over to Kim and Michelle to talk about even more resources that New Jersey has.
Thanks, Maya. And you're exactly right. We have so many wonderful resources, here in our state for individuals and for agencies. So again, I'm Kim Burns. I'm from Atlantic Prevention Resources, Tobacco Free for Healthy New Jersey. I'm the Southern Regional Coordinator. I also work with our Atlantic Quit Centers. We are one of 11 quit centers across the state that are here to serve residents. We have 11 quit centers. They're in Atlantic, Cape May, Cumberland, Salem, Hudson, Mercer, Middlesex, Monmouth, Ocean, Essex, Passaic, and Union. Unfortunately, not 21. We would love to have 21, but our 11 can cover, counties where there is not a quit center. And just want to let you know that many of the quit centers and their staff are available to come on site to your facilities to do presentations and groups. We are the quit center that worked the video that you saw in the very beginning of the presentation. We worked with Crossroads Behavioral Health. We've been there on site for about 3 years. We do groups in the mental health program, but also in the recovery program. And I'm just going to turn it over to Michelle because she's been boots on the ground, really working with those clients. And she just has a few things to share about that.
Thanks, Kim. So yes, I'd just like to reiterate the positive benefits for providing cessation resources to your clients who are in treatment settings, either residential treatment, we can come in and run continual groups, or IOP, we can run continual groups. They can join our existing groups. We have virtual groups, or simply a presentation to let you all know the great resources that we do have out in New Jersey. So in regards to adapting smoke-free policies in your behavioral health center, it's crucial for safeguarding the health and well-being of both clients and staff during recovery. So even secondhand smoke, it's a known health hazard, and exposure in healthcare settings can lead to serious health issues for non-smokers. Or I've heard so many times, oh, I'm in recovery, or now that I'm in recovery, I began smoking, right? Sometimes people who enter treatment centers who weren't otherwise smoking will begin to smoke because that one aspect of needing connection, right? When somebody's in the grips of addiction, it can be so isolating. And so the common theme is go out on a smoke break with people and, facilitate that community or connection. But we want to kind of provide resources and provide outlets for people to gain connections with others instead of smoking, different outlets and different coping mechanisms, because we don't want to swap one addiction for another, right? Like we want to learn how to live happy, joyous, and free without needing an artificial substance to put into our body. Like say there's a difficult conversation had, or say, something, even a celebratory thing. We want to learn how to teach our clients to participate in journaling, walking, connecting with others, having a phone call, things like this. And so providing barriers instead of encouraging smoking can really benefit clients and staff. So by adopting comprehensive smoke-free policies, facilities can eliminate this risk, ensuring a healthier environment for everyone. So even things like changing the designated smoking location can be beneficial. Like it's important not to be near a doorway or an entryway, things like this. So this is why continual work with us, if anybody's interested and wants to reach out to us, we can help with that. So treatment outcomes, I think the common theme is just understanding that integrating tobacco cessation into addiction treatment programs can improve the overall treatment outcome. So you guys saw firsthand that the studies that have shown addressing smoking alongside other substance use disorders leads to a better recovery rate and improved mental health. We want to combat that common narrative of, oh, they're losing everything else, all their other outlets. So let clients continue to smoke, or, focusing on one thing at a time. So we just want to reiterate the benefits of working on quitting smoking at the same time. And it actually, due to the studies, it does show that it improves overall treatment outcomes. So again, just reiterating that individuals who quit smoking, they experience reductions in depression and anxiety symptoms. Contrary to concerns that addressing tobacco use might disrupt just recovery, the evidence supports that smoking cessation will in fact improve it. So if anybody wants help implementing smoke-free policies, please feel free to reach out to us or ask any questions. Thank you.
Thank you, Michelle. Thank you, Kim. So now we'd like to take some time to have a little Q&A session with all of our speakers. I know we only have a few minutes left, but I do see something in the Q&A that I would like to direct towards our speakers. So I will just read that off, and anybody who's spoken today is willing to answer. Again, we have Dr. Steinberg here, we have Melanie Bennett, we have Maya, Kim, and Michelle available to answer questions. So how does the consumer's mental health improve when they quit smoking? I know physical health can improve.
I mean, I would say Michelle just touched on this, that there's a lot of things, smoking contains nicotine, as we all talked about. Nicotine's a stimulant, so anyone with anxiety issues doesn't want to be taking a stimulant into their body. So that's one thing. The 7,000 other chemicals have other effects on the brain. What I would say is it's besides that, it's actually stressful to be a current tobacco user these days with all the policies around tobacco use. So it's anxiety producing to try to worry about when you're going to get your ability to get your next cigarette and how you're going to afford it, things like that. Nicotine withdrawal presents difficulty concentrating, irritability, restlessness. So that certainly will affect and depressed mood is a nicotine withdrawal symptom. So most of the mental health diagnoses that we see, you could see how they'd be worsened by someone who smokes and goes through nicotine withdrawal.
Okay, thank you. We have another question in the Q&A. Do you need any special certification to run a quit group? And then there was another one that just popped in that kind of goes with that. Do insurance companies pay for quit groups? So maybe somebody from a quit center can answer that.
So to run a quit group, it'd be important to participate in the training that Dr. Michael Steinberg shared earlier to become certified in running these groups and have the appropriate information. And then you're able to run the quit groups within your center or your facility. You can also reach out to existing quit centers who can direct you to their existing groups. There's virtual groups, and then there are in-person groups, and there's also presentations as well. But I would highly suggest, if staff members are interested in learning more information about the benefits of what we've been talking about today, to participate in that Rutgers training as well.
Thank you. And I just see one more question. Hopefully we can quickly answer in the QA, and it might have to be our last. But are there any updates on potentially addressing nicotine pouches, Zins, or any other brands?
Also, there was a question, I'm sorry, Michelle, but there was a question about the cost or health insurance covering quit groups, just to reiterate that they're free. So I didn't want to miss that. I don't know if that was covered.
Yeah.
Go ahead, Michelle.
No, I was just going to say, so we always tackle the trending products in our Don't Get Vaped In trainings as well. So there's more evidence about Zyn, nicotine pouches, vaping. Tobacco companies are continually trying to turn over new products to kind of, weave their way around different laws or, influx the mind of youth. So I'd encourage you guys to attend our new Don't Get Vaped In training that's happening on July 17th, where we discuss the trending products and the impact of that. So even though a person isn't smoking a Zyn pouch, it's still providing that addictive nicotine substance, and a person would become addicted to this. So there could be a time and place where they don't have access to that, and somebody might have a cigarette, or somebody might have, and then the addiction becomes enough to where they begin, dual use. So we suggest staying away from all addictive products. But yeah, so that's a new product that we dive deeper into during our Don't Get Vaped In training. I'll put the registration in the chat as well.
Perfect. Thank you, Michelle. And I want to thank all of our speakers for their time today. And if you all have any unanswered questions that our speakers were not able to address, please send them. You'll see our contact information on the next page, so we can get those questions to the speakers so your questions can be answered. And always reach out to our tobacco-free team here, and hopefully we can address any of your questions, needs for resources, quick groups, anything like that as well. I would just ask that you scan the evaluation that you see here, and you will be provided a certificate once you fill this out in the coming week in a follow-up email. I would also like to have our contact information up here. So these are our different regions. You can reach out to any of us, or you can reach out to our tobacco free, and we can get you in contact with anyone that you need to provide those resources for you. So again, I want to thank you all for joining us today. And I want to thank, again, all of our speakers and our tobacco free team here for being here to talk about the importance of tobacco cessation and behavioral health.
Thank you, everyone. And the Rutgers training is, there's a link there in the chat. Michelle Kennedy dropped that in for those interested.
Thank you.